So she truly liked that decompression,
Oh yeah, the traction.
decompression of the spine. So how I do it, I place my two hands like this on the top. My right one is dominate. I'm holding it, left one is supported, and when I'm just leaning back. You see, I'm leaning. I'm not doing my arms like people will see. You're gonna injure your shoulder too. So I'm lean back. If I'm standing, I can stand up and lean too. But I'm gentle, and I just pull, hold, and release. Pull, hold, and release. Also, what she Regina liked it. She liked that. I call that ring, like that ring, like that. Uh, when the diamond holding in those whatever
Oh,
how
the
they're called.
setting for the
Yeah,
diamond.
setting for the diamond. So this is the diamond. This is my setting for the diamond. I'm up, come up here, get my elbow, and here we go. You see, it's diamond. Diamond, the head inside that. I'm not covered the ear. Some people get covered the ear. It's created vacuum and you push too much. You see, my finger is open. The ear is right there. And what I'm doing, I can do talk to chin. I can move around. You see, I'm pulling. She's completely, my elbow's on the floor. You can hold a bigger head. You can do side bending. She like do the side cross arms. You see the cross arm, and you can bend to one side.
I love that, yeah.
She loved that stuff. She like that pulling. Here we go. You feel that click?
Mm-hmm.
Wow, it's just amazing. You just click it and pull this way. She's breathing. She relaxed. I do not side bend that neck. You see, the head is turning. So I turn the head. I'm not do side bending. I don't want to put too much pressure on that cervical. I'm going to show you one more time how I do it. So you see, you lean and the head is kind of following and rotated. It's not tilted. And now I'm push that, kind of create that push and stretch. Not the, yeah, it's pulling. Switch. Same thing, you see? I can do standing, I can do sitting. You can do more. She loved more. She liked resistance, push back against me, and let it go. And of course, I finished my session and now the decompression, decompression of the spine. And David, he don't like to squeeze sternocleidomastoid. I love to squeeze sternocleidomastoid. It's like
on migraine people.
And migraine, yeah. No matter. You bend to the side you're working on. So right, the sternocleidomastoid pops up, and I'm just do gently pull up. And you can see I don't use any oil at all. So I want to feel that fascia.
For me, that's a must on a migraine, but I also understand from talking to so many migraine patients,
exactly.
Not two migraines are created equally. So what works for one person, I love this.
Yeah.
Might be a death sentence for your person.
Yeah, like I said, it's just like you always you build this.
Not really a death sentence, but
Yeah, no. It's you're right. Like I said, for some person go to the ice bath is going to be released that migraine. For someone, it's going to be the killing.
Oh, for me, it would kill me.
Yeah,
I need heat. Not cold.
Yeah, some people love heat. We're all different because you know who's involved in everything. Who? Can you guys tell me who involved in everything?
Santa?
No.
This guy right here. Right in here. Mind. The mind is creating everything. Create the studio, create me, create David. Everything is created by mind. And mind can create those pain and discomfort. For trauma and stress, this is all common stress. I can tell there's 100 stories. I went to this meditation center for 10 days. You have to sit down and meditate 6 hours. My brain create that lower back pain, that suffering in my spine and everything. So he pushed me out. He said, you have to get out of here. And day 7, I move out. I mean, I step outside. Since I just step outside, my pain is gone. He's like, here we go, I won. So my mind is trick me. So you always trick us. But it's just deep. It's not our scope of practice. What massage therapists can do, working on those 18 points, give you nice calm massage, working on this area, get your breath work, and you're going to feel better. This is what we can do for you. So give us a call if you need help. We're here in Los Angeles. We can go to your house or come to our clinic. Thank you. That's it. You want to go a little bit work more. We can turn off.